Today I'm here with Dr. Grayson Woods with Woods Gynecology and Aesthetics. We're talking all about women's health today. If you have a question, go ahead and give us a call. 615-737-PLUS is the number to call. We've been talking about pap smears and self-breast exams and just the overall women's health check that should be happening once a year, hopefully at a gynecologist. And we transitioned into menopause, which is such a huge topic, I know. I want to dive a little bit deeper into some of the symptoms and maybe one that people don't like talking about or maybe embarrasses: low libido. I'm sure you hear it from patients, or maybe you have to pull it out of them a little bit. Is that fair?
That's right. It is fair. It is fair, and it's very common. And lots of women are embarrassed to talk about it. And again, it kind of can frequently come with this perimenopause phase as hormone levels are dropping, and they're not having general energy, much less libido, and that just kind of is part of the broader picture. And so, and we do see it in younger populations too. And one thing to be aware of is birth control pills can actually really affect libido.
Really?
And so we have discussions about that fairly frequently.
Wow.
And just for patients to be aware that certain medicines can, and sometimes antidepressants and others can affect it too. And so we really try to strategize.
We see the commercials all over TV for the men's side of things, but you don't see anything for women. So what are the options for women?
Well, and again, the first thing is always trying to figure out, is there cause? Are there medical causes, underlying causes? Are there medicines causing it? And then we're diving into, hey, what does the daily picture look like? Are we really so overcommitted in life that there's no time and energy left for this? And then there are new medical therapies. There's a new medicine called Addyi that is specifically indicated for the very low libido.
Are you seeing good results with that?
The data has shown really good results.
Wow.
It has. So there definitely are options.
Okay, and is that something, again, that women may have to take for the rest of their life, or is just kind of something to see what happens?
That's right. See what happens. Again, depends on which phase of life they're in. Typically, the younger they are, if we're struggling with the problem, then they may need something for longer term.
Sure. Acne. We all think we get rid of it when we get out of those teen years, but it comes back with menopause, or even whatever, 20s, 30s, babies. I know that. What is this? What's going on?
Yes.
Why? Just the hormone level gets
mostly
crazy,
hormone fluctuations. That's right. Some women have excess testosterone that creates more breakouts, or polycystic ovarian syndrome. There are a handful of things that we see that lend itself to more acne. So we can address that too.
Yeah, you have a gynecology practice. You also have an aesthetics practice, and I love the very organic way this all came about. Can you tell that story?
Sure. Well, we really got started with the aesthetics as we saw more and more women with polycystic ovarian syndrome and syndromes with excess testosterone causing facial hair, sometimes hair on the chest and abdomen, and so frustrating, and it can be very hard to manage. And we actually started with laser hair removal to help those women. It was really an organic start, and also they tend to struggle with acne too. And to have a place where they felt safe to talk about it and address it, and
you're already at the gynecologist. You've already crossed that barrier, so let's just talk about it all, right? It's a very smart way, absolutely, to do business, and also to be a patient in a practice and say, let's just talk about it all. So what can your patients expect on that side of the practice?
Sure. Well, on the aesthetic side, we offer non-invasive procedures such as Botox and dermal fillers, peels, and a full skincare assessment. Again, it's always, we want to start with the basics. What are we using? What kind of needs do we have? We see lots of sun damaged skin with pigment and wrinkles, very common. Trying to get started with some basic foundation, and then kind of just come up with a roadmap.
And skin changes a lot with menopause, right?
It does.
What do you see in patients?
Well, we tend to see waves of acne, dryness, and volume loss. Generally, in the mid-face, we just tend to lose the collagen, the elasticity that we then see as lines and wrinkles. And so we want to try to help that.
Yeah, you start looking in the mirror and you're like, wow,
I didn't see that before.
No, a year ago, I didn't look like that at all. Have you felt like it's kind of a good hand-in-hand practice that women can go and just from one to the other?
We already know, yes.
Yeah.
Yes.
Well, let's back up just a little bit and talk about women and birth control options. what's new, what's not new, what women can consider now as they're on this journey of, wanting a baby or not wanting a baby, so forth and so on.
Sure. Well, we have a variety of options, but the most common and continually the most popular is some form of hormone, whether it be birth control pills. There's a hormonal patch that's once a week. There's a vaginal insert that's once a month. So there are a variety. There's also progesterone, long-acting progesterones, whether it's in way of a shot or the little insert that one can last up to 3 years.
Wow.
So probably the biggest advances are the length of what's available. Then the intrauterine devices have become increasingly popular. They've been much more popular in Europe for a really long time. And
What do you think that is?
Great question. I'm not sure. I don't know if it's just a cultural willingness to,
Right.
definitely here, definitely in the U.S. There were issues with a really old one, I won't name it, that created a lot of problems. And so generationally, we would have grandparents, parents saying to their daughters, "Oh, don't get that thing," because that created a lot of problems. But the newer versions, newer meaning 20 years, have been very, very well received.
What do you tell patients who are considering an IUD? What do they need to know? Pros, cons?
Well, the biggest pro is how long it can stay in. So there's one has progesterone, long-acting progesterone on it, and the other is copper and plastic. They're both a shape that looks like a little T. It's a very benign. It doesn't have teeth or prongs or anything like that. And they can last between 3 and 10 years.
Wow.
So it's very long-acting. Once it's in place, you don't feel it or see it, and it's there working,
To prevent a pregnancy.
That's right.
That's its goal.
Yes.
But
and also the progesterone ones lighten periods. So for women who struggle with really heavy, really painful periods, it alleviates that as well. So that's, again, why that one is very popular.
And then in that time frame, you say, you know what, it's time to have a baby, or my plans have changed. It can easily come out?
Yes, it comes out anytime. That's right. It can stay in for up to those lengths of time, but it can come out anytime.
Is there any sort of waiting period that you need to do to kind of get your body back into the normal gear, or you're good to go?
No.
Yeah, once it's out.
Oh, generally speaking, once it's removed, yes, excuse me.
Since we have so many more options now than just the birth control pill, does that say anything against the pill? That women have been looking for other options?
Well, birth control pills just can have a variety of side effects, whether it be sometimes headache, sometimes nausea, sometimes it can create irregular cycles. So those are some of the negative, the low libido, like I mentioned before. Definitely user error. If you've tried to take a multivitamin every day, it can be a little harder than you think to remember. So a lot of it is the remembering.
Yeah, absolutely.
And so the efficacy rates of at least with pregnancy prevention with IUD is 10 times more effective than pills.
Wow.
So pretty substantial.
That is. And infertility, do you deal with that in your office? Tell us how. What do you recommend to patients? When should they start to come see you if they're trying and it's just not happening?
Well, I tell my patients, if they're frustrated in their attempts to get pregnant, or really with anything, just come, let's talk it over. So there's really not a set time. So I discourage, try for a year and come see me. I don't like that, and I don't think that's appropriate. And yet for women who are in their late 30s and early 40s, we definitely know time is of the essence, and so I like for them to come a little sooner, maybe at the 3 to 6 month window. But what we do is we again do a thorough evaluation to try to determine what's going on, and a lot of times that consists of blood work, a pelvic ultrasound to look at the uterus, look at the ovaries, make sure there's not a structural problem such as a polyp or fibroids, that kind of thing, and kind of work our way.
Do you find most women who struggle with infertility have never really had issues with their health before, and it's just like, why isn't this happening? There's no indicators, right?
Generally there are not. Some of the population say if they've struggled with endometriosis for a long time, so, sometimes they have difficulty, but most folks even who have it do not. So that's correct. It's a new
it kind of comes out of
nowhere,
left field. It's like, wait a second, I never guessed this would be hard to do. Let's jump to a quick phone call. Liz is on the line. Good evening, Liz. What's your question tonight?
Yes, I was wondering, how do you best prevent things like yeast infections and urinary tract infections?
Wow, great question, because
Great
neither one of
question.
those is fun at all.
No, not at all. Good question, Liz. Well, with bladder infections, staying hydrated is very helpful. For some women, we tend to see sometimes bladder infections that are intercourse and intimacy related, although the data has actually been a little iffy on whether or not that's truly causative, but we all think that emptying the bladder frequently around those times can be very helpful. And where yeast infections are concerned, again, very common, especially in the hot summer months. And some people will see them related to the time in their cycle, just staying drier, changing clothes, really breathable underwear, those kinds of things. Probiotics tend to help also with both bladder infections and yeast infections.
Really? And medicine for the yeast infections, do you usually prescribe something for your patients?
We certainly can. The over-the-counter, the one-night inserts work well too. So
cranberry juice, is that an old wives' tale, or is it
a
legit?
little bit. Is
it? Yeah. So you don't have to suck down.
That's right. A lot of calories.
Okay, very good. We're going to take another quick break. More of your phone calls, more of our questions when we come back. Stay with us.